Over $4,000 cost savings, 30% reductions in adverse events, keeping people out of the hospital, not increasing the cost of care by having to go to the emergency room. Who's responsible for introducing this conversation to patients? I mean, what doctors should be responsible, because obviously the application of this genetic information can be in any disease.
So I think there's been some resistance to the information because of the broad impact. But the ideal healthcare provider to I would say make this part of the standard of care is pharmacists.
Mm,
Pharmacists go to school just as long as medical doctors, and they have 5 times the coursework in pharmacology. They are very well versed to take this on. The issue is, unfortunately, decades ago they required less education, and federally they're not recognized as healthcare providers. So a nurse practitioner PA has more payment and recognition, even though they have less schooling or training than pharmacists. And that has created some issues. I think one of the biggest reasons that we have such catastrophic increases in healthcare costs without seeing improvements is the fact that we are not helping that profession practice and get paid at the top of their scope of practice. But those are the specialists, and there are instances in which they can be leveraged in more and more states. So, states for at least commercial and Medicaid can say, hey, these should be healthcare providers and we should pay them like other healthcare providers. And that's very much helping. I would say that people should talk to any of their providers that are giving them medications that are impacted by pharmacogenetics. If you Google CPIC, the Clinical Pharmacogenetics Implementation Consortium, but just CPIC, drug gene, it'll pull up a list of all of the medications that have drug gene interaction guidance. Anything that says A or B, that means there are recommendations to change a drug or a dose if you have pharmacogenetic information. People can go look for their medications there.